Using crutches as an assistive device can help the patient keep weight off of their injured or weak leg, assist with balance by increasing their base of support, and enable them to perform their daily activities more safely. Before the patient uses their crutches, the first thing to look at is fitting. To size axillary crutches, start by adjusting the length of the crutches to try and match the patient's height. Next, with the patient upright and in proper footwear, adjust the axillary pad so that there is enough space between the pad and the armpit to fit 2 to 3 fingers. From there, adjust the hand grip so that it's aligned with the ulnar styloid process, wrist crease, or greater trochanter. Forearm crutches require more coordination than axillary crutches, however they allow for greater control over movement during ambulation. With the patient upright and in proper footwear, place the forearm inside the cuff and hold onto the hand grip. Adjust the cuff so that it rests 1 to 2 inches below the olecranon process. Like the axillary crutches, adjust the hand grip so that it's aligned with the ulnar styloid process, wrist crease, or greater trochanter. Next, position the tip of the crutches 2 inches lateral and 4 to 6 inches anterior to the patient's toes to confirm the proper crutch length. The patient's elbows should be flexed to 20 to 30 degrees when holding the hand grips. Their weight should rest on their hands and not on the axillary pads to avoid damage to the nerves and blood vessels in the armpit region. In a 3-point gait pattern, the 2 crutches are advanced first, followed by 1 lower extremity. This gait pattern allows for more rapid ambulation, however, requires high energy use due to the strength requirements from the upper extremities and the weight-bearing lower extremity. Shown here in a swing 2 technique, after both crutches have been advanced, both lower extremities are advanced simultaneously to the level of the crutches. The therapist should stand slightly behind and to the involved side of the patient. Depending on the severity of the injury, the therapist may need varying levels of assistance to help with functional mobility. Contact guard is shown here with one hand on the patient's trunk to help with balance. In a swing through technique, both crutches are advanced first, followed by simultaneous advancement of both lower extremities beyond the level of the crutches. This technique allows for faster ambulation, however requires an even greater amount of energy. In a 3-in-1 gait pattern, the crutches are advanced simultaneously with the patient's partial weight-bearing or toe-touch weight-bearing lower extremity. The uninvolved lower extremity is then advanced to or beyond the crutches. This gait pattern is slower than the 3-point, however requires less energy, is more stable, and allows for functional use of the partial weight-bearing lower extremity. A 4-point gait pattern involves the use of bilateral crutches, with each crutch and the opposing lower extremity moving in an alternating and reciprocal pattern. The pattern starts with the advancement of the crutch on the uninvolved side, followed by advancement of the involved lower extremity. The crutch on the involved side is then advanced, followed by advancement of the uninvolved lower extremity. This gait pattern, which approximates a normal gait pattern, is slow but very stable and is used when the patient requires maximum stability. A 2-point gait pattern also involves the use of bilateral crutches, with each crutch moving with the opposite lower extremity simultaneously. The pattern starts with the advancement of the crutch on the uninvolved side and the involved lower extremity simultaneously. Then the crutch on the involved side is advanced with the uninvolved lower extremity simultaneously. This gait pattern is a more rapid form of ambulation than a 4-point, however, it requires more stability. modified 4-point gait pattern involves the use of only one crutch. This pattern is used with patients who only need one crutch or only have one properly functioning upper extremity. The crutch is held in the upper extremity contralateral to the involved lower extremity. The pattern starts with the advancement of the crutch, followed by advancement of the involved lower extremity, and then advancement of the uninvolved lower extremity. Similar to the modified 4-point gait pattern, the 2-point gait pattern also involves the use of only one crutch and is used with patients who only need one crutch or have one properly functioning upper extremity. Again, the crutch is held in the upper extremity contralateral to the involved lower extremity. The pattern starts with the advancement of the crutch and the involved lower extremity, followed by advancement of the uninvolved lower extremity.